NCLEX note on metabolic disorder or endocrine system. Today, let's start with diabetic insipidus. It's a disorder characterized by the excretion of large amount of dilute urine and increased thirst. As per the causative factor, it is divided into two types, neurogenic and nephrogenic. In neurogenic, there is deficiency of antidiuretic hormone due to damage to the hypothalamus or pituitary gland. In case of head injury, brain tumors, infection, surgery or genetic mutation, this condition can happen. And in nephrogenic diabetic insipidus, there is kidney's inability to respond areas. In case of chronic kidney disease genetic disorder, medications like lithium electrolyte imbalances can lead this condition. And the signs and symptoms are polyuria, frequent urination, excretion of large volume of dilute urine, 2 to 20 liters per day. Must remember for the NCLEX. Polydipsia, excessive thirst, and dehydration, hypovolemia, low specific gravity of urine, elevated serum osmolarity, hypernatremia. And the treatment depends upon the type of diabetic insipidus. In case of central DI, desmopressin, thiazide diuretics. In case of nephrogenic DI, low salt diet, thiazide diuretics, indomethacin, desmopressin may not be effective in this case. And the general management of DI is fluid replacement. Because of large amount of urine volume, IV fluids are needed to correct dehydration. And the nursing managements are monitor vital sign, iron monitoring, weight monitoring, daily urine specific gravity checks, administering prescribed medication on time, providing education to the patient and patient party, and preventing complications. And the main thing to remember are there is high amount of urine output and excessive thirst to the patient. Desmopressin is used for the treatment, and for the nursing management, maintaining dehydration and maintaining electrolyte imbalance is important. Let's go on another topic, that is SIADS, syndrome of inappropriate antidiuretic hormone, is a condition where the body secretes too much antidiuretic hormone ADS, leading to water retention, hyponatremia and fluid overload. This is just opposite of diabetic insipidus, must remember, so that you can handle questions properly. And the causes are like central nervous system disorders, brain injuries, stroke, tumors, infections, malignancies like small cell lung cancers, medications like antidepressants, pulmonary disorders, and the post-surgical conditions, especially after major surgery. And the signs and symptoms are like sign of hyponatremia like nausea, vomiting, seizure, coma in severe cases, fluid retention in the body due to water retention, decrease in urine output, hypertension, tachycardia and concentrated urine, high specific gravity and dark color urine. And here we go for management and treatment. Fluid restriction, first line of treatment, limit fluid intake to 800 to 1 liter per day to prevent dilution of sodium. Sodium replacement, hypertonic saline 3% for severe hyponatremia, only in a controlled environment or proper watch. Slow correction is needed to prevent from serious neurological condition like pontine myelinolysis, and medications like vaptans to block ADS receptors and promote water excretion, loop diuretics like furosemide, and treat underlying causes of SIADH like discontinuing causative medications, treating infections, cancers or brain disorders. And here we go for nursing management. Monitor patient vital signs, especially for changes in blood pressure and heart rate. Monitor intake output, daily weights. Monitor lab results like serum sodium and osmolarity level, urine osmolarity and specific gravity. Provide safety due to confusion, lethargy, ensure patient is safe, and provide fall precautions, patient education, teach about fluid restriction, potential symptom of hyponatremia, and when to seek medical attention. And key points to remember are, it is characterized by excess ADS secretion, whereas in diabetic insipidus there is low amount of ADS and the symptoms are just opposite. In this case, the fluid restriction is primary treatment. Sodium correction must be done slowly to avoid neurological complications. Now here we go for next topic, that is hypothyroidism. In this condition, the thyroid gland does not produce enough amount of thyroid hormone, that is T3 and T4, leading to a slowing down of body's function, for example, slow metabolism. And the causative agents are like autoimmune disorders, iodine deficiency, thyroidectomy, radiation therapy to the neck, medications like lithium, pituitary disease like secondary hypothyroidism. The signs and symptoms are like fatigue, weight gain, cold intolerance, dry skin, constipation, hoarseness, memory problem or cognitive slowing, bladder bradycardia, hypotension, muscle weakness, joint pain, depression, slow reflexes, periorbital edema, puffiness of the face, brittle hair and nails, elevated cholesterol levels. For the NCLEX must remembers the sign and symptoms at disease conditions and T3, T4 level and TSH level, so that you can differentiate this condition from hyperthyroidism. Now here we go for treatment, thyroid hormone replacement, as there is low amount of T3 and T4. Levothyroxine is most commonly used, must remember for the NCLEX, and dosage adjustments are made based on TSH level, and nursing managements are patient education regarding taking medication at the same time every day. And must remember that the levothyroxine is given at the morning time with empty stomach. Avoid taking other medication with this medication plus calcium or iron supplements. Monitor for overdose like hyperthyroid symptoms, palpitation, weight loss and sweating. Assess cardiovascular status based on the risks of bradycardia and hypotension. Diet, encourage a balanced diet, especially with adequate fiber to manage constipation. Check for sign of myxedema coma, which is sign of severe life-threatening hypothyroidism. Also the important topic for the NCLEX. Okay, now let's go on another topic, that is hyperthyroidism. It's a condition where the thyroid gland produces excessive amount of thyroid hormone T3 and T4, leading to overactive metabolism. It's just opposite to hypothyroidism, must remember. Autoimmune disorders like Graves' disease are the most common reason of hyperthyroidism. Thyroid nodules or toxic multinodular goiter, thyroiditis, excessive iodine intake, medications like amiodarone, pituitary tumors can lead hyperthyroidism. And the signs and symptoms are like just opposite to hypothyroidism. There is tachycardia or palpitation, weight loss, nervousness, anxiety, irritability, excessive sweating and heat intolerance, tremors, fatigue, insomnia, increased bowel movements or diarrhea, menstrual irregularities, enlarged thyroid gland, thin fragile skin and brittle hair, muscle weakness, eye problem like ectophthalmos. And for the treatment like methimazole and propylthiouracil are used. Must remember the name of medicine. To control tachycardia and tremor and anxiety, beta blockers like propranolol are used. Radioactive iodine therapy to restore overactive thyroid tissue. Thyroidectomy, surgical removal of thyroid, considered for patients with large goiters or those who do not respond to medications. Here we go for nursing interventions. Monitor cardiovascular status, promote patient rest, monitor weight, administer medication as prescribed. Post surgical care includes like after thyroidectomy or radioactive iodine therapy. Monitor for complications such as hypocalcemia due to damage to the parathyroid glands and laryngeal nerve damage. Airway monitoring after thyroidectomy. There is risk of airway obstruction from swelling and hemorrhage. Must remember this nursing management. What is your nursing intervention after thyroidectomy? Patient education regarding adherence to the medication and follow-up. Discuss sign of hypothyroidism if there are ongoing radioactive iodine therapy or thyroidectomy. Thyroidism is the most important complication to know for the NCLEX, and we will be discussing about this condition later. Now here we go for myxedema coma. It's a severe life-threatening complication of hypothyroidism, typically triggered by stressors such as infection, trauma, or cold exposure. It occurs when there is a prolonged period of untreated or inadequately treated hypothyroidism, leading to extreme hormone deficiency. Precipitating factors like infection, exposure to cold, trauma, sedative, narcotics, anesthesia, discontinuation of thyroid medication. The clinical manifestations are like hypothermia, low body temperature often below 95 degree Fahrenheit or 35 degree centigrade. Severe lethargy or stupor, which may progress to coma, bradycardia, hypoventilation, hypotension, hypoglycemia, hyponatremia, edema, cool pale dry skin, coarse dry hair, constipation, muscle weakness, decreased reflexes, mental confusion or delirium, thickening of the skin. And here we go for treatment, thyroid hormone replacement. The preferred treatment therapy is IV levothyroxine. The supportive care are like warm the patient gradually, avoid rapid warming to prevent cardiovascular collapse, respiratory support, mechanical ventilation may be required due to respiratory depression, glucose and electrolyte, administer IV fluids, glucose or correct electrolyte imbalances. Hydrocortisone may be given to address adrenal insufficiency, which can occur in patients with hypothyroidism. Monitor for vital signs, especially temperature and heart rate, ECG for arrhythmia. Now the nursing management: monitor patient airway and breathing due to respiratory depression, administer thyroid replacement therapy like IV levothyroxine, warm the patient gradually, assess neurological status, monitor cardiac function, correct the electrolyte imbalances, provide adequate comfort to the patient. Okay, now here we go for thyroidism, also known as thyrotoxic crisis, is a rare but life-threatening complication of hyperthyroidism characterized by an extreme exacerbation of symptom of hyperthyroidism. It occurs due to untreated or poorly managed hyperthyroidism, often triggered by an stressful event such as infection, surgery, trauma, pregnancy, discontinuation of thyroid medication, severe emotional stress. And the signs and symptoms are high fever, severe tachycardia, hypertension, profuse sweating, agitation, restless, severe irritability, confusion and delirium, nausea, vomiting, diarrhea, dyspnea, weakness and fatigue, hyperreflexia, atrial fibrillation or other arrhythmias, severe irritability or paranoia, seizures. And let's go on treatment and medical management. It's a medical emergency. Immediate treatment is needed to prevent from death. Antithyroid medication like profylthiouracil or methimazole, iodine solution to block the release of thyroid hormone, beta blockers like propranolol or other beta blockers used to control tachycardia, reduce fever and alleviate the symptoms like tremor, corticosteroids to reduce inflammation and manage adrenal insufficiency, supportive cares like cooling measures, IV fluids, oxygen therapy, cooling blankets, monitoring vital signs including heart rate, blood pressure, oxygen saturation level and ECG for arrhythmias. The nursing managements are monitor patient vital sign, continue monitoring patient heart rate, blood pressure and temperature, administer anti-thyroid medications, ensure timely administration of profylthiouracil or methimazole and iodine preparations, administer beta blockers to control tachycardia and symptoms like tremors, cool the patient, gradual cooling to reduce fever and prevent heat stroke, support patient airway and breathing, hydration, administer IV fluids to manage dehydration and correct electrolyte imbalances, monitor for arrhythmias, keep close eye on the ECG for sign of atrial fibrillation. Now here we go for next topic, that is Addison's disease. It's a disorder of the adrenal glands in which the adrenal cortex fails to produce enough cortisol and often aldosterone, leading to deficiency in these vital hormones. The causes are like autoimmune destruction of adrenal glands, infection, adrenal hemorrhage, cancer, pituitary or hypothalamic disease. And the signs and symptoms are like fatigue, weakness, weight loss, anorexia, hyperpigmentation, hypotension, salt craving, nausea, vomiting, abdominal pain, diarrhea or constipation, muscle weakness, irritability, depression, hypoglycemia, electrolyte imbalances, tachycardia, dehydration and shock in severe cases. And the treatment are hormone replacement, hydrocortisone or other glucocorticoids to replace cortisol, fluorocortisone to replace aldosterone, salt supplementations, especially during hot weather or exercise. For the emergency management in adrenal crisis, intravenous hydrocortisone is given along with IV fluids and glucose to stabilize blood pressure and blood sugar level. And if this condition is not managed on time, it can lead adrenal crisis or Addisonian crisis, which is life-threatening emergency, often triggered by stress, infection, trauma, leading to severe hypertension, shock, dehydration, and electrolyte imbalances. And the nursing management includes monitor patient vital signs, especially blood pressure and heart rate, to detect any sign of hypertension and shock. Monitor lab values, administer hormone replacement therapy, ensure correct dose of hydrocortisone and fluorocortisone, educate patient on medication adherence, patient education regarding how to handle stress, teach about the adrenal crisis symptoms, severe weakness, confusion, hypertension, vomiting, and when to seek medical care. Monitor for sign of an adrenal crisis. Symptoms include extreme fatigue, dehydration, severe hypertension, confusion, which requires emergency treatment. And the next topic is Cushing syndrome, is a condition characterized by an excess cortisol in the body, leading to a variety of symptoms of a group of symptoms. That's why it is known as Cushing syndrome. The causes are in exogenous factor. It can be caused by chronic use of corticosteroid medicine, and in endogenous factor it can be caused by like pituitary adenoma leading to excess ACTH productions, Cushing disease, adrenal tumors, ectopic ACTH production, and other is genetic factor. And the signs and symptoms of Cushing syndrome are weight gain, especially around abdomen, face, moon-like face, and the thin skin that bruises easily, purple stream marks on the abdomen, thigh, breast, muscle weakness and fatigue. High blood pressure, increased blood glucose level leading to hyperglycemia or diabetes is just like opposite to Addison's disease. Excess hair growth, menstrual irregularities in women, mood swing, irritability, depression and other psychosis. Osteoporosis and increased risk of bone fracture, easy bruising and slow wound healing. Increased susceptibility to infection due to immunosuppression, hypokalemia, thinning of the bones. And the treatment depends upon the cause factor. In exogenous Cushing syndrome, there will be gradual tapering of corticosteroids under medical supervision to prevent withdrawal and adrenal crisis. And in endogenous Cushing syndrome, the surgical removal of the tumor and the radiation therapy for pituitary tumors, medication to decrease cortisol productions like ketoconazole, mitotane, mifepristone for medical management, lifestyle modifications, patient symptomatic management plus patient education regarding patient conditions and counseling plus supportive cares. And the nursing managements are monitor patient vital signs, especially blood pressure, monitor blood glucose level due to risks of hyperglycemia and diabetes, assess for infections, monitor electrolytes, provide emotional support, patient education, teach about the importance of gradual steroid tapering if using corticosteroids, explain treatment options, including surgical interventions and medications, educate on infection prevention due to the immunosuppression associated with cortisol excess. And here are the key points for the NCLEX. Must know these things if you are going for NCLEX. Okay, now next topic is pheochromocytoma. Usually on this topic, main thing to remember is definition and it's like what happens on this condition and nursing management. Actually, it is a rare condition, usually benign tumor of the adrenal medulla that results in the excess production of catecholamine, particularly epinephrine and norepinephrine. This leads to intermittent or sustained episodes of severe hypertension. The signs and symptoms are severe hypertension, headache, palpitations, tachycardia, profuse sweating, anxiety or feeling of impending doom, nausea, vomiting, pallor, weight loss, and fatigue. And treatment or surgical management includes the removal of tumor, which is definitive treatment of pheochromocytoma. Preoperative management includes the use of alpha blockers, for example, phenoxybenzaimine, to control blood pressure and prevent a hypertensive crisis. Beta blockers might be used after alpha blockades to control tachycardia, but never before alpha blockade due to risks of exacerbating hypertension. And the important nursing considerations are monitor for sign of hypertensive crisis, which are severe headache, chest pain, blurred vision or dizziness. Administer medications as per doctor prescription. Educate the patient on recognizing symptoms of hypertensive crisis and the importance of follow-up in post-surgical phase. Okay, now let's know the key differences between hypoglycemia and hyperglycemia, which is the most important topic for NCLEX. This might be simple, but also the important for NCLEX. Hypoglycemia, there is low blood sugar level below 70 mg per dl, while in hyperglycemia, there is high blood sugar level. The blood sugar level above 130 mg per dl before meals or higher than 180 mg per dl after meals, and it is also depends upon the individual or their causes. Hypoglycemia is caused by excessive insulin or excessive diabetic medications, skipping meals or eating less than usual, increased physical activity, alcohol consumption without food. And hyperglycemia is caused by insufficient insulin or insufficient diabetic medications, excessive carbohydrate intake, stress, illness and infection, lack of physical activity and use of corticosteroids. Hypoglycemic symptoms include shakiness or trembling, sweating, rapid heartbeat, tachycardia, dizziness or lightheadedness, hunger, confusion, irritability or difficulty concentrating, in severe cases seizure, unconsciousness and coma. And the hyperglycemic symptoms include increased thirst, polydipsia, frequent urination, polyuria, fatigue, blurry vision, dry mouth, unexplained weight loss, nausea, vomiting in severe cases. And the extreme cases are like diabetic ketoacidosis and hypersmolar hyperglycemic state. If this occurs, this can lead confusion, coma and life-threatening conditions. And the treatment of hypoglycemia includes immediate management like immediate consumption of fast-acting carbohydrate, glucose tablet, fruit juice or regular soda, and in severe cases direct IV push of dextrose. And the treatment of hyperglycemia include insulin or other medications as prescribed, adjust diet and physical activity, hydration to prevent dehydration. And the final one is Graves' disease. And if you get this topic and you're in topic, just think about the hyperthyroidism. It is same as hyperthyroidism. Actually, this condition leads hyperthyroidism, and the pathophysiology is actually same. Sign and symptoms are also same, and management is also the same. Plus, there is presence of goiter and enlarged thyroid gland may be visible or palpable. Exophthalmos protrusion of eyes seen in about 40% of the patients. For the management, in this case, same as hyperthyroidism, antithyroid drugs are used, beta blockers are also used, radioactive iodine therapy to destroy overactive thyroid tissue, thyroidectomy. And being a nurse, we need to monitor for thyroid storm, which can occur fever, tachycardia, delirium, and even death in severe cases. Educate patient on medication adherence, potential side effects, ensure regular monitoring of thyroid tests. Thank you for watching. Do subscribe.